Welcome to WorkSpan TV. I'm Marcia Rhodes. In today's episode of Research in Brief, we are discussing the 2011 survey report, Employee Benefits, Accountability, and Consumerism. This is a report by WorldatWork, now in its third edition. I'm joined by Lenny Sanicola, Senior Benefits Practice Leader for WorldatWork. Welcome, Lenny.
Thanks, Marcia. Great to be here.
Lenny, this survey report has a wealth of data and information on benefits, including healthcare benefits and retirement benefits. And we only have a limited amount of time. So why don't we focus on 3 of the 5 recommendations you provide in the study, and for each of those 3, tell us why they're important.
Number 1 would be that measurement is important. We had several questions in the survey that asked survey respondents about their efforts in terms of educating their employees about their benefit programs and making them better consumers. It was clear from the survey responses that companies are not doing enough in the measurement space. Measuring results is critical for a variety of reasons. Obviously, to determine your return on investment, are you spending your money in the right places? But also it helps identify where your challenges lie and perhaps where you are better able to spend your money to target certain educational initiatives.
As they say, you get what you measure. For those employers that do measure, what were some of the prevalent ways of measuring?
On the healthcare side, survey respondents reported an increase in participation in health promotion programs, an increase in the use of wellness website tools and HR portals, and some also reported a decrease in healthcare costs. On the retirement side, survey respondents reported an increase in participation in retirement programs, an increase in employee contributions, and also an increase in diversification among asset classes.
Interesting. Let's move on to takeaway number 2.
Takeaway number 2 would be that we probably can do a better job of explaining consumer-driven health plans, or Cdhp as they are known. We asked several questions regarding employers' offering of these programs, and we asked that question all 3 years. And we saw an increase in the number of employers that were offering consumer-driven health plans alongside more traditional plan options. However, in terms of employees actually selecting to participate in those plans, we only saw a slight uptick. That leads me to believe that we're probably not doing as good of a job as we can in communicating these programs to employees and demonstrating how they can be used effectively both for themselves and their families. These plans can be complex at times and do require a lengthy period of communication, especially if you're transitioning to these types of programs for the very first time.
Do you expect the trend of increased Cdhp offerings to continue?
Yes, I do, Marcia. Not only our surveys, but surveys by many others have indicated this trend continuing. One of the questions we did ask was specifically, are employers eliminating the more traditional plan offerings and only going with Cdhp, in other words, full replacement, and we did see an increase in that as well.
Do you think healthcare reform is playing a role in the increase in Cdhp offerings?
I don't think so. We asked specifically what time frame these plans were put in, what time they were thinking of being put in, and most of the respondents reported having made these decisions prior to early 2010 when healthcare reform was passed.
Let's move on to takeaway number 3.
Takeaway number 3 would be the use of social media in total rewards communications, benefits education. I was surprised to find that only 3% of survey respondents reported using social media platforms in terms of their benefits education. Now, we didn't have social media as an option in the 2004 and 2006 survey, but clearly in today's world, I was surprised to find such a low percentage. We know that organizations are indeed using social media for marketing and other organizational initiatives, but it's not prevalent in the total rewards communications space. I would imagine 2 years from now, if we were to repeat this survey, we would see an increase in the number of employers that are using internal blogs, wikis, internal Facebook networks, Twitter, and other social media platforms to better educate their workforce about the use of their benefits as well as other total rewards programs.
Since social media is still low on the list, what were some of the more popular options?
Survey respondents reported written communications, health promotion and wellness initiatives, and employee meetings as being the most prevalent. Now, in terms of written communications, we didn't break that out, so I don't know if what was most prevalent was the traditional use of the distribution of printed materials, or it was more in the intranet space and email messaging.
Did you find any innovative approaches?
I don't know if this would be innovative, but certainly there was an increase in the use of self-service technology. Over 65% of survey respondents reported using web-based tools and technology in general in educating their workforce about their benefits and making them better consumers.
In closing, was there one interesting trend that jumped out at you?
One thing that did strike me was, in terms of who was the primary champion or advocate for employees becoming better consumers of their benefit programs. In all 3 times that we asked that question, in all 3 surveys, the top HR executive was the primary champion, and still is. However, we saw a decline in the top benefits or rewards professional being the primary advocate, and we saw an increase in the number of organizations reporting the CEO, the president, or some other senior leader being the primary champion. So what does this tell us? Benefits, and clearly healthcare, is eating into bottom line profits, and benefits continue to play a greater percentage of labor cost dollars. Therefore, it's being recognized by senior leaders that if we're going to expect employees to shoulder more costs, to be more accountable, to be better consumers of their benefits programs, we need to educate them first. So if we're going to expect them to pay more and be more involved, then we at the top really need to promote the importance of educating our workforce. So I think that's a good thing. But it did surprise me that we saw that uptick as we did.
And I think the involvement of senior leadership speaks to the importance of benefits overall.
Absolutely, Marcia.
For a full copy of Employee Benefits, Consumerism and Accountability 2011, go to WorldatWork.org. I'm Marcia Rhodes.